Before you leave the ward following your embryo transfer, you will be given instructions about continuing with the progesterone pessaries, and also you will be given, most importantly, a date when you do your pregnancy test. When you have done the pregnancy test, you will need to call the clinic to let us know the result. If the test is positive, which we hope it will be, we would give you an appointment for an early pregnancy scan between 2 to 3 weeks from the positive test, depending on your history. You'll be advised to continue with the medications that you're on until the scan has been done. Unfortunately, every test is not positive, and if you have a negative test, then you must still call us and let us know immediately. We will arrange to see you back in the clinic for a follow-up consultation as soon as you wish to be seen. There is a counselling service available for your support if you ever feel the need. We hope that you have found these videos useful and helpful in understanding the IVF process and to know what to expect if you should decide to start treatment. If you have any further questions or would like to know more, please contact your nearest care clinic.